next, Authentically Detroit welcomes newly elected City Councilperson Denzel McCampbel, as well as Jasahn, Larosa, and Iris Taylor of the Southeast Michigan Perinatal Quality Improvement Collaborative. Keep it locked. Authentically Detroit starts after these messages.
Have you ever dreamed of being on the airwaves? Well, the Authentically Detroit Podcast Network is here to make those dreams come true. Formerly known as the Deep Network and located inside the Stoudemire, the Authentically Detroit Podcast Network offers studio space and production staff to help get your idea off of the ground. Just visit authenticallydet.com and send a request through the contact page.
Hey, y'all, it's Orlando. We just want to let you know that the views and opinions expressed during this podcast episode are those of the co-hosts and guests and not their sponsoring institutions. Now, let's start the show.
Hello, Detroit and the world. Welcome to another episode of Authentically Detroit, broadcasting live from Detroit's East Side at the Stoudemire Wellness Hub. Inside of the Detroit East Side Community Network's headquarters, I'm Donna Gibbons-Davidson. Thank you for listening in and supporting our efforts to build a platform of authentic voices for real people in the city of Detroit. We want you to like, rate, and subscribe to our podcast on all platforms. We have a full house in the studio today, and Orlando is out, but I'm honored to have the newly elected City Councilman for District 7, Denzel McCampbel, as well as my friend Jasahn, Larosa, and Iris Taylor from the Southeast Michigan Perinatal Quality Improvement Collaborative, who are here to discuss their groundbreaking Black Fatherhood Initiative. And by the way, this is the same Iris Taylor who serves on the Detroit Public Schools Community District School Board. So we have two elected officials in the house. Welcome to Authentically Detroit, everyone.
Thank you.
Okay. How is this blessed day finding you?
You know, it's been a great day. It's a sunny day outside, and I was sharing my birthday is tomorrow, so it's been a great year, and I always get in a reflective mode right before my birthday. So it's a sunny, great day out there.
All right, Sagittarius in the house, right?
Oh, it's still Scorpio.
Scorpio. Oh, we're still Scorpio. Oh, okay. I've got my dates wrong. All right. So we're going to start actually by talking about this SEMPQIC. Did I get that right?
That's exactly
Fatherhood
right.
Initiative. SEMPQIC is leading a groundbreaking initiative to fully embrace fatherhood, especially in the lives of Black children. Their Black Fatherhood Initiative directly addresses the stark disparities in maternal health outcomes faced by Black mothers by elevating the often overlooked role of fathers. Recently, SEMPQIC showcased this work at its Black Maternal Health Equity Summit, which marked its 10th anniversary this year. The summit, dedicated to advancing maternal and infant health in Wayne, Oakland, and Macomb counties, brought together healthcare professionals, industry experts, and community leaders to highlight solutions, with fatherhood emerging as a critical factor. Through community outreach and a new curriculum, SEMPQIC is equipping dads with practical tools, knowledge, and a supportive network to be active, engaged parents in the perinatal journey onward. This work not only strengthens families, but also tackles systemic barriers that have historically limited Black fathers' involvement. Wow, this amazing initiative. Tell us about it. How did you get started?
Well, let me start just a little bit about SEMPQIC. SEMPQIC is the Southeastern Michigan Perinatal Quality Improvement. It's Region 10 of the state's disparity units that they established. And SEMPQIC Coalition has Wayne, Oakland, and Macomb counties. And we exist for the sole purpose of promoting or enhancing maternal and infant health, or the reverse of that of saying trying to decrease infant mortality and maternal mortality. So that's why we exist. But what's unique about it is that we work across the full continuum. We work with systems, health systems, insurances. We work with community-based organizations. We do a lot of grassroots. We try to push out initiatives and grant dollars to help people on the ground not only understand the issue, but what can they do to help us as a collective to impact, because we realize that it's not just the providers who we need to work with, but we also need to work with the people on the ground. So that's what SEMPQIC is all about.
And I think before we started, I shared with you my background, right? So my first job was in health education and community organizing at the Community Health Awareness Group in partnership with Detroit Receiving Hospital and the Detroit Health Department. At that time, almost everybody who was Black in the city of Detroit was treated and diagnosed or treated by Detroit Receiving Hospital. And so there was this amazing doctor, Dr. Crane, who reached out to our organization, Community Health Awareness Group, and sent all of the people diagnosed to our organization for us to provide them with case management support. And I, if you can believe it, at 22 years old, I facilitated the support group for the organization. And so it was like a master's degree, PhD level understanding. I had just come out of the University of Michigan. And I've been kind of, in a protected bubble. But what I learned in that process was how people ended up where they were. A couple things. Number one, the people I was serving were as intelligent as all my classmates at U of M. They just didn't have the same opportunities. And that was mind-blowing to just see how brilliant and funny and enriched some of them were. And the second thing was so many of them said, now that I've been diagnosed with AIDS, my life has never been better. But at that time, their life was almost over, too, because HIV/AIDS was a death sentence. And that led me to the process of saying, what if I could intervene in people's lives earlier? Why wait until then? Because I could see all of the brilliance that was just being trapped and lost by all of these systemic inequalities. And so it really changed my life. But Detroit Receiving Hospital is also where you got your start, Dr. Taylor. Can you talk about that?
I started at Detroit Receiving Hospital as a staff nurse, actually. And I went from the staff nurse to a head nurse to working in staff development. Then I became a director of nursing and then eventually the vice president of nursing. And ultimately, I ended up being the president of the hospital. So I was president of Harper Hutzel for a while. Then I was president of Detroit Receiving Hospital. And then I worked at the corporate level in the DMC. So I've had a full career, but I've been able to do it all in the Detroit Medical Center.
Now, did you ever work for Grace Hospital?
It was
I'm talking about the
Grace.
one on the one on
6 Mile
on 7 Mile and Myers.
On the corner of
I'm talking about way back.
Yes. We used to rotate staffing sometime, and I used to moonlight out there.
Yeah.
That was interesting too.
I was a candy striper at that hospital.
Were you really?
Yes, when I was in college. And my dad was a doctor at that hospital, Donovan Givens. And so that was my entry into Detroit Medical Center was through Grace Hospital when it existed. My sister was a nurse at Sinai Grace. And yes, she was an emergency room nurse at Sinai Grace. So I have so many connections to the DMC family. And I know over the years, you have seen so much happen with fathers, with mothers, with babies, where you understand the significance of fathers in maternal health. And that's such a unique way of looking at maternal health is we need fathers there to help protect mother's health. I'm assuming that's one of the things. And also in infant health. So how did you make that connection? That's really an exciting connection to me.
Well, as we look at the entire journey from prenatal to actual a year after the child is born and all aspects of it, how could you not look at the family unit and what was missing in our ability to provide services? And what we really discovered is that the father was desiring to be present, or the mate was fathering to be present, and we didn't allow him to be present. We didn't engage or embrace him as providers. And so that started the conversation that led up to where we are now, where we include elements of fatherhood in everything that we're doing around this entire perinatal journey, from before the person gets pregnant until a year after the person has delivered.
That's wonderful.
Yeah.
Can you talk about this, Jasahn? I know that you are a real advocate for fathers' rights and male empowerment. Can you talk about that?
Yeah, Jasahn Larosa speaking here. First of all, I was so honored when I got the call from Dr. Iris, Vernice Anthony, Alethea Carr, and the SEMPQIC team. I knew that they had been looking really closely at the role of fathers in increasing maternal and infant health and vitality. And they're a women-led organization and have been successful in securing a lot of partnerships from the state to to philanthropy and local partners, and I think understood pretty quickly that they wanted to center the voices of men. And with the ultimate outcome, as Dr. Taylor pointed out, being to increase infant and maternal health and vitality, but also realizing that fathers and Black fathers in particular are deserving of services in and of ourselves. And so we started conversations around the development of a guide that brought fathers in, not as derelict or absent or needing to be taught about what fatherhood is, but in an effort to remove some of the barriers that fathers face to involvement. We see that the outcomes for moms and babies are radically improved when there's that continuum of support. And we also find the data bears out that strongest and most consistent support comes from the birthing partner. And Black women experience birthing disparities when Black fathers experience barriers to involvement. And so the guide that we developed over the course of some months tries to honor the contributions of dads from an asset-based perspective as opposed from a deficit frame, as if Black fathers are people who need to be fixed. It is a mix between didactic and non-didactic information. So while we're presenting information, we're also having conversations and coming to collective insights about what fathers need and what they're experiencing. It is evidence-based. It is, as I said, strengths-based, and it's trauma-informed.
So, I'm the type of mother who is going to try to be in the birthing room whenever I have a grandchild, okay?
Right. Yeah.
That's just me, all right? Because I think I'm a doctor anyway. I'm like, no, that's what that says. My daughters both had doulas. I'm like, I know more than them. No, just joking. But they had doulas, and then, I'm there. And one thing I noticed in some hospital systems, fathers are treated as guests.
That's right.
And why would a
unwelcome
father be a
participants.
guest and not a participant in the birth of their child? It feels as though having to choose between me and the dad, I kept losing out. But I'm just saying, some instances, you don't want the father to ever be removed from that room. What are policies that different hospital systems have around that, and how are you seeking to change that?
Donna, you said it quite well, and dads are treated as guests at best. And in many cases, we're seeing that fathers feel like they're outsiders, like they need a hall pass, like they're somewhere they're not supposed to be. And I don't actually know, we don't have a full understanding of what some of these policies are that they have in place, but I can tell you about some of the practices we've been introducing, not only in our region, but across the state as we tour different regions and talk to birthing providers. It's, we're going to be in here. You know that mom just had a cesarean session. Why do I have to ask you for a bed to sleep in? She's going to be spending the night. When you're having these bedside huddles, include dad into that huddle. Or when we're looking at the whiteboard, mom's name is written on it. Put dad's name next to it. We're a family. Consult with the father. Include the dad. Give the dad assignments. And these are when the providers hear some of these best practices and some of these suggestions, they're like, never thought about this before, but they're really receptive to it. No one's challenging them on it.
What about like birth certificates, right? The dad's name does not automatically go on the birth certificate. Can you
That's
talk
right.
about what that barrier looks like?
Yeah, so there are multiple levels to that that barrier. One of them is cultural. I mean, so fathers are afraid that they're going to be penalized, sent to jail, have their licenses stripped if they establish paternity through the birth certificate if they're experiencing poverty when the baby is born. But the bigger issue is that paternity is not automatically established. This is something that fathers have to fight for, and there's no real incentive because within the Black community, I would say in particular, fatherhood seems to be a phenomenon that is criminalized. For consensual sex, two people have a baby, and if one of them is if they're experiencing poverty, one of them is criminalized for it, and appropriately. So we rally around the birthing parent, the mom, to provide support. But dad goes to jail, get his license suspended, and a host of other things.
That's if he doesn't pay child support.
That's if he doesn't pay child or can't afford, if he's experiencing
Well,
poverty.
I'm not talking about the reason. I'm saying that the criminalization is the non-payment of child support, not being a father itself, right?
Right.
Yes.
I just wanted to clarify for people who are listening that you don't go to jail for having children. You just have to pay for them, whether you can afford them or not.
Right. Mhm.
And the system will say if a mother is receiving benefits from the state, then they will look at the father as responsible for paying a portion of those benefits, even if the mother doesn't ask.
Right.
Correct.
And so that's something that ends up happening with indigent parents, where the father is like, I cannot afford to be the father in some instances, correct?
Absolutely.
All right.
But from a system perspective, though, they'll go in and ask the mother the father's name if she wants it on the birth certificate. That's who gets the information.
Right.
And if she doesn't give the information, then you get birth certificates where father is blank.
Right.
I've seen situations in extended family members where the father was present at birth and wanted to, but there was a process by which the
sign
hospital
an
would not.
affidavit.
He had to sign it. The hospital did not make it easy to put the father's name
Right.
on there. So I think sometimes we blame mothers and fathers when in fact the system
it's not
does
behavioral,
not.
it's systemic.
Sometimes there's a systemic barrier. We're talking about people who are, if you're not married, there's a penalty placed on unmarried parents who are couples.
Yes, absolutely.
And so I just wanted to point that out because I think it's important that we think through all of the barriers to fathers' participation. What I'm hearing also is that fathers should be involved in the birthing process even before the mother gets pregnant, if possible, and then all through the pregnancy. Can you talk about what that looks like in terms of what's your experience in fathers? You've been in the healthcare industry for so long. I know you have some stories. I'm telling stories, but you have more. Tell us about it.
The reality is, though, that it's a conversation that's not even had. The conversation of do we want children? Or what happens if we have children? But then more importantly, to have children, you need to be healthy. And so let's talk about health behaviors. So if I'm a diabetic or I'm hypertensive or I just have a poor nutrition status or I just, we don't encourage women to be healthy. And men need to understand that as you're talking about potentially having a family, that being healthy first is one of the first steps towards that. And then we know we have all the social determinants and health disparities that go on to sometimes create some barriers, but that's where we start the conversation.
A lot of times we tend to think of physical health and mental health as being two separate things, like your mind exists outside of your body. But in recent years, I've been reading a lot about the fact that the mind is the body. It's all connected, that you feel things in your stomach. And I know that there's been a lot that's been researched around stress during pregnancy and the fact that toxic stress during pregnancy can impact the neural development of an infant. Yeah. And so I would imagine that there's also a somehow correlation between mothers and fathers getting along and maybe some pre-baby counseling so that they learn how to resolve conflict more effectively. Because a lot of us have inherited stuff, right? We all inherited stuff. But a lot of us have inherited feelings. Like, so if my grandfather did this to my grandmother and my mother did this to my father, no, I'm not going to let any man do this. Yeah. And if my mother did this to this person, I'm not going to let any woman do this. And so it's not always modeled for us how to have healthy adult relationships.
And a lot of it is skewed by stories that just aren't accurate. I want to come back to that question of criminalization because you made a good point in talking about legal status if people are criminalized, punished legally. But we're also talking about the way that stories are told. And I recently told the story of my youngest child's birth when I took the stage at the summit this fall. When our youngest baby, Claire, was born, my wife and I were unmarried. And this was a period of newness for us, and we should have been celebrating. I had a new job at Focus Hope, and I had a new car. I bought us a new home, and I was pulling into our driveway, and there was a squad car outside. And my wife was at the door, and I walked up to the front door, and there was an officer looking for me. He was shocked to see her in the house because this was listed as my address. And he had asked her, she reflected later about whether I was in earshot, whether I was home, did she feel safe? And he served me a subpoena for friend of the court, and we later appeared in court, and my wife and I stood there defending our love as the judge questioned her about whether anybody was pressuring her at home or whether she felt threatened when she was saying, like, we don't need child support, we're about to be married, and we live together. And like, we had to advocate for our love. And so so even if I wasn't charged with something, there's this feeling of criminality.
Absolutely.
Like I had done something wrong, despite everything that we were doing together.
Wow, that's awful.
Yeah, but this is the pressure that families, particularly Black families, are up against. You're right; it's a systemic question.
But
this
you know,
isn't
we
my
have
wife, this
real
isn't
stories, right?
The sisters,
Because I got some stories, and they're true.
Yeah.
Some of them I've observed for myself, right? About, I always think about, we are how many generations from being enslaved and dehumanized and pitted against each other and having our families torn asunder. And until we heal, sometimes we pass on generational harm to the next generation unintentionally, right? So I knew stories about things that happened in my family background. I can't remember not knowing them. It's talked about, right? Because my family, we're all talkers. I don't talk the most. We all talk a lot, and everybody's very opinionated, right? And so you're hearing all these stories, and it impacts how you interface with men.
Yeah.
I didn't have any brothers that I grew up with. I found out I had a brother, but he was, not in my household when I was young. And my father was very tyrannical. And so I didn't have relationships with men that were healthy in my household. I had friends who were men, but I didn't have that close family relationship with men in my household that were healthy. I learned how to let go of that as an adult because you make a lot of assumptions. Men are like this. And it may or may not be fair because we generalize our pain. I think that there is so much bashing that goes on both sides that is encouraged, that we're not encouraged to really see the humanity in each other and see the vulnerability in each other.
And it's encouraged by external forces. It's not us. We're not the problem. It's systemic forces that are discouraging us from being community and family. And
We also need some trauma informed practices, okay?
Yeah.
Because without trauma informed practices, it doesn't take an outside force. Like once they get that in you, then
it's no longer a trauma. It's now an innate part of you. It's part of your character.
Yeah,
it's part of who you are.
It's part of your story. It's part of what you think. I'm happily married for 5 years, right? And I love my husband so much, and we get along so well. Until I met him, I really did not believe I could be loved by a man as I am.
Wow.
Okay?
Yeah.
Because people say, well, like, men don't love strong women. Men don't love women like that. And then, and so I don't know how to change myself to make myself into a weak woman because I'm not going to be weak. Okay, I'm going to tell you this right now.
Change yourself.
I'm not. That's what I'm trying to say. And so I just decided that this was not something I could have.
Yeah, wow.
And that's such a generalization to say men don't love strong women, right? Yeah. My husband loves strong women. His mother was a strong woman. There's plenty of men who love women of all different, but that's the narrative. And so now we sort of, internalize, but we also protect ourselves against what we expect people to think of us, or we expect them to do. And I'm certain that there's another narrative that women don't like nice men. Women don't like men who can be trusted.
Nice guys finish last.
Nice guys finish last. And it's all because of that one woman who you shouldn't have been with in the first place, who rejected you when you were young, one with the bad boy. And now that's all women, you know, and somehow we don't see each other really.
We're not talking to each other. We're listening to external forces. I mean, which really gets to the heart of, I think, the work that's being led by Dr. Iris and the SEMPQIC team is having healing conversations, creating these guides, bringing us together because no one's coming to save us. We've got to do this work ourselves.
Yeah.
Part of what's unique about the color of fatherhood is that we start in the prenatal phase and go to 1 year after the child is born. But along that same line, while we're giving you all the didactics, the man doesn't recognize that the person is going through a lot of bodily changes in the first trimester, and her body may not even be changing. So in their mind and their eyesight, well, she's not pregnant, or how come she's not doing all the other things we want, So from that perspective and all the didactics teaching that, but also having all the conversations around. So, how did you feel when you heard that you were going to be a father? What did that feel like? What are the anxieties that go along with the first time becoming a father, and what is going to be my role and responsibility and all of that? And we carry that theme all the way across into 1 year later, and the mom is experiencing postpartum depression. And what does that look like? So that the dad is prepared for the entire, all possibilities across the entire journey.
I have a question on just about, as you were coming in, as I saw someone ask for the
guide,
the guide, right? What has the community response been to the guide so far, and how does that engagement look for folks in the community?
I think that this has been a resource that has been so widely received on a positive level. And if I'm being frank, it's not even just the guide. That's the tip of the iceberg. It's the attention that's been given to this, and it's the investment that's been put into fatherhood. People are like, oh, they see us. A huge part of the guide, we open up trying to root the fathers in a collective sense of purpose by dispelling a bunch of myths about Black dads, throwing out statistics that most people haven't heard before. That most Black men, ages 15 to 49, have no children, 54%. Black men are more likely than any other group of folks to be raising children that are not just biologically tied to them, but not biologically tied to them. We talk about involvement. CDC saying that Black men are more involved with our children than any other group of men in the country. And when we just share some of these statistics, fathers feel so seen, and they're brought into a space where we're developing trust, and they begin to share out some of the challenges that they're experiencing. And from there, we build community in the sense of purpose around the entire community, I think.
That's amazing.
It's picking up momentum, yeah.
For sure. And another question I had, I talked to folks about, in the city of Detroit, we see an unfortunate trend of poverty going up and childhood poverty increasing. And one thing that, as I talked about on the campaign trail, was that we absolutely have to have programs that get folks out of poverty, but also talked about parental care. And this guide and the work that you are doing kind of lends into that, of how are we actually addressing and taking care of parents that are raising kids in the city of Detroit. What will you say you want to see from policymakers in the city or at the state or federal level when it comes to this?
I'll let Dr. Iris go first, and then I got some thoughts that can follow up.
Okay. From a systems perspective, we need providers and organizations to embrace the notion that we have to care for moms and dads, and that moms and dad are included in the discussion and in the care in the beginning. And that's a system impact that we're trying to impact on, or to encourage to happen. I think from a policy perspective, just allowing changes of how you get on a birth certificate, policy changes that encourage or enhance the father to be legitimized in the beginning, even though they may not be married.
Still a father.
Yeah,
Yeah,
he's still a father. And we have this little saying, cute saying that we say that I don't care where you go, there's a father.
That's right.
There's a father everywhere. And so that would be two things I would say.
Just to add to it, Dr. Iris and Denzel, I think, and probably you too, Donna, know that my wife runs an organization called Black Marriage Movement, or the Marriage and Fatherhood Fund. And I think what a lot of us would like to see, and this goes to your earlier point, Donna, is the government invested over decades in disrupting our families. And I think that it's time now for the government to invest in healing. So even if parents are not romantically involved, we need investment that gets us talking to each other and working toward healing, as opposed to dividing us. Our relationships have become politicized. It's become unpopular for us to talk to each other and be on one another's side. And we need government support to be able to say, No, it's okay to talk to each other and to co-parent in ways that even if you're not romantically involved, you can continue to support each other.
Yeah. I mean, I think that we have been torn apart for centuries, not decades.
You're absolutely right.
I think that we have so much nostalgia about grandparents, but some of them grandparent stories are not very attractive to some of the grandchildren. That's why we ended up being different, right? It's like, never let anybody do this to me. You know, from the woman's standpoint, you know, it's not always that great, right? And I think that we have got to understand the harm of racism in really destroying or undercutting the fabric of our community. And one of the challenges I think that I'm hearing from you is also, when you think of a Black father, what do you think of? When you think of a white father, what do you think of? If you don't think of a good man when you think of a Black father, you need to be re-educated. And if you don't think, you know what I'm saying? We need to stop assuming that you have to convince Black fathers to love their children.
You just need to get out the way.
And also help the healing.
Yeah.
Another thing I think about, though, is when I first started my career and I was working in the community, I actually worked with this organization in the 90s, running a program called Partnership for Economic Independence. And our focus was on families, intervening with families. We got a lot of foundation support to support family structures. And right now we have youth support, but we don't really invest in families as a society anymore. It's almost as though young people need mentors more than they need parents. And we know that a young person's best outcome is going to be when their family is doing well. So I think as a society, we've got to elevate families. Now, the families may not all look the same, right? But whatever that family structure is, let's invest in families. Stable parents have stable kids. And parents who are all messed up and ignored, you can't fix that when they come to your after-school program.
That's right.
They go back home to that mess and chaos. And so we have to love the people they came from. You know, I always think that we love children until they become adults, and then we stop loving them in our society. Black children, I should say. Black children become disposable. When they're little kids, they're so cute. Let's all invest in them. But let's understand that a lot of people with problems as adults had problems when they were little, and nobody ever intervened. And we have an opportunity to really help set the record straight. I think that what the work you're doing is amazing. And I just want to know how we get involved at Eastside Community Network. This is a wellness hub, and we bring the community together for all kinds of purposes. How can we participate in the SEMPQIC program? Is there any role?
Yes, most definitely, because we always encourage involvement from community-based organizations. With this particular theme of fatherhood, we have been going out in the community to various groups of fathers and having this conversation and looking for organizations who want to take the curriculum and host meetings and have the kind of conversations that are represented in this guide, and then do some follow-up. We encourage people to get the guide and use it as a guide to facilitate a group. That's how you help us to have a collective impact.
All right. Well, we'll follow up on that. I promise you. We are going to have some things here. Obviously, this is near and dear to me, but I know there's other listeners who really care and want to be involved. What would their first step be to get connected to this initiative? Is there a phone number, an email address,
if you go
a website?
If you go to the SEMPQIC website, which is SEMPQIC.org, on there is a tab that says fatherhood, and the curriculum is listed. We've did some videos. And we have videos of fathers that you can view as well, and then there's an opportunity to say I want to volunteer, and then as we're doing some of the work in the community, we'll connect you, or to say I have an organization and would like to be involved. We'll enroll you into the collaborative and the coalition itself as well.
Oh, wonderful. Okay, so if you are interested in being involved, the website is SEMPQIC.org.
That's absolutely right.
SEMPQIC. SEMPQIC.org. I hope people listen, get connected, and let's help build our families.
There's also an email,
Okay.
Kizzy M, that's KIZZIM, at metrosolutions.org.
Okay.
She's our executive director.
All right. Well, thank you. We have an executive director. We have two amazing leaders who have turned their attention to this process. We're going to take a break, and when we come back, we're going to talk to Denzel about his run for city council and his recent election.
Interested in renting space for corporate events, meetings, conferences, social events, or resource fairs? The MASH Detroit Small Business Hub is a 6,000 square feet space available for members, residents, and businesses and organizations. To learn more about rental options at MASH Detroit, contact Nicole Perry at nperry@ecn-detroit.org or 313-331-3485.
And we are back with our good friend Denzel McCampbell, who is the managing director for Progress Michigan.
Yes.
I met you when you were serving in the staff of our friend and Congresswoman Rashida Tlaib,
Absolutely,
right?
yes.
And then you ran for city clerk, and we got really hopeful, and you explained to us what a clerk should do.
Yes.
After Garland Gilchrist also ran and explained to us, but you helped open the door some more. And that was not successful. And then you ran for District 7 City Council.
Yes.
Talk about that.
You know, it is, I learned so much in that city clerk's race about, we did have to do a lot of political and public education on that campaign. It was just not saying, hey, vote for me. It was, hey, vote for me for city clerk. And folks would say, for city council, what's going on here? So I learned a lot about that race and the need to constantly talk to folks and be communicating to them about the role and who I am, and was very grateful to have the opportunity to run for Detroit City Council District 7, as you mentioned. And this campaign was an open seat because the current member, Fred Durhal, ran for mayor and did not run for re-election. And there was a lot of, similar in the city clerk race, introducing myself to a lot of folks, right? Some folks did remember me from running for city clerk, but this was a race that we centered the needs of our folks in the district. And I know neighborhoods was folks talked about neighborhoods a lot in the campaign on all levels this year, but we were really intentional about how do we lift up policies and a focus that centered what the basic needs in our neighborhoods were when it comes to economic justice, making sure that people have access to quality, good-paying jobs and skilled trades training, recognizing that folks need every opportunity to learn skills, not just in a 4-year or 2-year college. Thinking about how do we center public transportation, because we don't talk enough about how 1 in every 3 households in the city of Detroit does not have access to a car. And in District 7, we have a transportation department that our buses don't run as frequent as they should. On Plymouth, it runs every hour. Wow. And then we talked a lot about the need to have a right to breathe clean air and drink clean water, and how all of this connects to folks having thriving neighborhoods that they can get, whether it's going to get affordable fresh food, a good meal to build up community, coffee, a healthcare facility, a pharmacy, right in their neighborhoods, that they don't have to go outside the district or outside the city to get that. And folks really connected with that vision. We knocked over 30,000 doors. We sent over 100,000 text messages, made tens of thousands of phone calls, and we're just wanting to be extremely present.
How much money did you raise?
So I raised, I think it was around $182,000.
Was there any city council candidate who raised as much as you?
I believe the only other candidate that raised as much was Councilmember Santiago Romero, and neither one of us took any corporate PAC dollars.
Let's talk about that, though, because you guys did something pretty unprecedented in Detroit. What connects you to the Councilwoman Santiago Romero? We both have had a start in community organizing and connecting with folks, and being in coalition with other organizers and organizations that are working on the ground on the issue. So I feel that both the Councilwoman Santiago Romero and I are able to, one, also have lived experiences as we're talking to folks on the doors, but also to say, okay, you may be talking to me about economic justice. I know folks that are working on that. We can solve that issue today, because often we have these big ideas that are needed and the policy solutions that are needed. But if I'm talking to someone and they are saying, I am in need today,
and I'm talking to them and say, okay, 4 years you'll be good. They'll look at me and say, that's not going to happen.
If you say that a lot, because a lot of times people don't really get any real responses to their immediate needs.
Yes.
But you are also, come on now, you are part of a larger movement right now of young, progressive,
Yes.
multicultural folks
Yes.
standing up and saying, we're going to run on our ideals.
Absolutely.
Can you talk about that race? Because we're all excited about what's happening in New York.
Mm-hmm.
But I'm like, they're not clocking what's happening in Detroit.
Yes. And, and thank you for that. So both the Councilwoman Santiago Romero and I, we're both members of the Metro Detroit, the Democratic Socialists of America's chapter. We have really pushed for a lot of progressive policies and are aligned with folks in the progressive movement here in the city of Detroit. And really, like you said, really connecting to folks about here's our vision to have a more affordable Detroit, a more equitable Detroit, a Detroit that actually brings folks to the table and not have these divisions, that we see that no matter who you are and no matter where you're living, that you deserve to have a city government that puts you first, that centers your needs and does not do the bidding of folks who are constantly going against our best interests. And that also creates a target on us, right? The folks that say, oh, you're not taking corporate PAC dollars. Well, you're actually in the community. What does that mean for example, I've heard this a lot. How will you balance the interests of community and business? Well, I don't see a need to balance if you're doing this right.
Yeah.
Right?
You know what I hear? I hear things like, well, you're not really running on Black people's issues. Like Black people don't need bus service and we don't need to breathe clean air. The way that Black people's issues have been, conflated with business interest is something that, I think President Nixon did a very good job of, this whole concept of Black capitalism. Capitalism is inherently racist if we're going to be honest about what capitalism is. Now, Social Democratic Party, I believe, is trying to balance that and say we've got to look beyond that. But I've heard those voices kind of critiquing that in New York City, and I hear it in Detroit, and yet it's happening where you're able to do something. And at a time where people are really trying to tear us apart and fragment our movements and say, well, Black people can't trust Hispanic people or Latino people because they hate us, all of them. Hate all of us, right? It's not stereotypes. But anyway, you and Gabby represent two different ethnicities, and yet you came together around shared values.
Yes.
And you're also aligned with our Congresswoman Rashida Tlaib and her values. And so I'm seeing this movement beyond identity of Black or Hispanic or Palestinian to say that we are people who care about our communities.
At the end of the day, what we're seeing is that we are seeing the wealth gap in this country expand. We just ended the longest government shutdown in U.S. history, and what was being used against folks was the ability to access food assistance and the denial of expanding subsidies to help cover healthcare costs. That has nothing to do. That is impacting Black folks. That is impacting Latinos. That is impacting Arab Americans, and it is benefiting those that the rich who are getting more and more money.
And quite quietly, it's impacting white people.
Exactly.
Because, the narratives that get spun help us believe that we are a threat to each other and that all white people are doing great while we're suffering. And by the way, a lot of white people believe all Black people are doing great because we get free everything. That's how they're able to divide our communities. And so you're part of coalitions because you are part of the Democratic Socialists of America, right? But you're also at least speaking with and coordinating with the Michigan chapter of the Working Families Party, right?
Yes, and I'm a member of the 12th Congressional Democratic Party, right? And I've worked in coalition with so many folks, and like you said, it's keeping those values and the shared values that we have to make sure that we're putting people first. And the one more example that I want to share is that this big ugly bill, right, that passed, right? The folks who were impacted immediately once it passed, we saw rural hospitals close, right? Was a lot, of course. in a year or so, we'll see Medicaid and Medicare cut. But the immediate thing was rural hospitals. And that shows that it does not stop at the city limits of Detroit.
Have you ever been to rural Michigan
Yep.
where the grocery stores are Dollar Trees or whatever? I'm like, where?
Dollar General?
It's amazing. I mean, that's in a horrible way. I was visiting rural Michigan, and you're driving through places and you don't have any broadband. You can't even get a cell phone connection in communities where you see people's homes. And you realize that injustice does not have geographical boundaries. It sucks the life out of communities, out of people. And the only way to keep people kind of oppressed is to make them believe that the people they should watch out for are the people who, like them, are struggling with some of the same things.
And that is what I want to make sure we are pushing back on, especially here in the city of Detroit. In District 7, of course, it is a majority Black district, but we have, and I tell folks this, we have significant Arab American population, significant Latino, and a significant white population in District 7. And these, as I go door knocking, I hear similar issues show up from folks of the need to tackle whether it's having truly affordable housing in the city, making sure that it's more affordable to live in the city of Detroit, transportation. Those, no matter who it is, those are the similar issues. Right. And we then have to say, these are the folks who are working against that. It's not based, like you said, it's not based on geography. It's not based on race. And we really have to have an indictment on how capitalism is showing up in our community.
I mean, environmental justice is an urban thing. But those battery plants that are seeping, poisons into the groundwater in rural America, that's not always Black folks, right? It's not all Native American. A lot of these are white people dealing with it. And, the siphoning of water for Nestle is not happening in a Black community where we're draining the aquifers. I think the extent to which we can see each other, I saw a woman recently who said, you can't hate people. It's hard to hate people when you're talking to them one-on-one. It's easy to hate people from afar. So I have two questions.
Yes.
And one little comment and two questions. One of them is that you ran for council in the far west side, and I'm on the far east side.
Yes.
And yet I see your election as being relevant to my community. Why are you relevant to the east side of Detroit?
One, just as we talk about the structure of city council and we talked about the charter, as I'm looking at the issues that are impacting our residents in District 7, and I see whether it's contracts, ordinances, or budget considerations that come across, I'm just not thinking about District 7 and impact. I'm thinking about how it would impact folks here on the far east side in District 4, how it does, in District 7, we talked about environmental justice, and we have issues with truck traffic and air pollution. We also know that there has been issues with air pollution here in District 4, right? And so it is impactful, for one, the vote that I'll have on city council, but also that I'm someone that has done work across the entire city and is in community with folks to be able to say, hey, we're experiencing that here. How are you experiencing that on the east side, Donna? And how do we work together to make sure we have a comprehensive policy in addressing that?
Yeah, because, I'm old enough to remember how the concept of district city councils got started. And a big part of that was most people on city council lived in the same neighborhoods. And when you read the city charter, as you know, the city charter talks about how district city council people can be elected. But it doesn't change the job duties of a city council person who gets elected from this district. They still have the same legislative responsibilities as they did beforehand. And the way I look at it is you have a congressperson who represents your district, and certainly you want them to bring home some of the bacon, and nobody does it better than Rashida. But, certainly you want that. But you also want them legislating on the behalf of the nation, not just your community.
Exactly.
And to the extent they only legislate on behalf of their own communities, they're really not doing their jobs, right?
No, and you want to have someone who has that view of the entire city. You want to have someone who is able to say, and also to build relationships with other council members to say, this is how it's impacting us in District 7. I see how you talk about this in your district. Let's come together to create a policy that's even more comprehensive in that way. And as you talk about council by district, is we also, as we talk about Congresswoman Tlaib, I want to make sure that we have an amazing constituent services program as well to address the immediate needs of folks, and then also create policy around what we see as the systemic thing that needs to change.
I mean, the mayor, the city council is responsible for approving appointees, not based on where people live, approving budgets, writing ordinances. All of these things have citywide significance. And if you have city council people who are only caring about what happens in their backyard, the mayor has too much control. Because if you take your eye off those legislative duties, then you have ceded that power to the executive.
Yes.
And we already have a strong mayor form of government.
Yes.
And we have a incoming mayor-elect I'm really excited about. But I'm excited about the structure of our government as well as anything else because, the structure of our government determines how well our democracy is working. And when you see a legislative body not really being as active or having the same kind of power input, then you see a failure of democracy.
You do. And you see a failure of democracy, you see a stifling of ideas, right? Because then you're not having the ideas that are needed at the table. You're seeing a singular view of how we address these needs. And it's a disservice to residents that we are there to serve. So absolutely, I agree.
Yeah. So in Detroit, all elected officials run nonpartisan races.
Yes.
But there's a couple of you, not just the two of you, but one more, I believe, who is working with you around ideas that have surfaced from the Working Families Party. You all got endorsed by the Working Family Party.
Yes.
And it's our District 4 councilwoman, Letitia Johnson.
Yes.
So you have 3 people. Talk about that.
Yes, I am deeply excited to work with Councilwoman Johnson, Councilwoman Santiago Romero, and the entire council. But I want to talk about them for a second because, this was an open seat, and it was a race that had quite a few folks that have run before, folks who that were in seats had a title, that have higher name recognition, and Councilwoman Johnson and Councilwoman Santiago Romero really went out to publicly support this campaign because we had those shared values, because they see why this vision of centering people, fighting for truly affordable housing, fighting for environmental justice, fighting for a government that serves people is needed, right? And that we have to go on that path. And I'm very grateful for them having that vision and being out there to support, and also then having a legislative agenda that absolutely recognizes the power that City Council has and the power that we have collectively, that we're bringing multiple districts together to say this is what we need in the city.
Yeah, what we did on Saturday with Councilmember Johnson hosted a budget workshop here. How forward-thinking to host a budget workshop in November.
Yes.
Most people don't start talking about the budget in the community until March or April, and all of the decisions have been made.
Exactly.
But to really help people understand the budget process, how to get involved, that's some real forward-thinking stuff. And we want to continue doing that. I feel as though on January 1st, you work for me too. So,
absolutely.
I'm going to hold you accountable.
Please do.
No, I'm excited about that. You've talked about a couple of things. We're working on truck routing ordinance, and that's been a real challenge. I think we have one in Southwest Detroit, but there's no truck routing ordinance that really covers our community. Is that a priority of yours?
It is. That is a priority, and to make sure that we are having truck routes throughout the city of Detroit, because it is impacting every part of the district where you have industry. We have the AMC project that now there's Universal. So there's the community along Plymouth, making sure that the air quality there is not impacted by the increase in truck traffic. We see that in every part of the city. So I do want to have a focus on improving our air quality, truck routes, and also making sure that our city is leading in having a green future, and not. I just want to make sure we're ahead of the ball and not reacting, because we have the ability to be that forward thinking. If we're just, like you said, around the budget, and also to say, what more can we be doing around environmental justice?
When I got this job in 2016, I had to interview for it, and I remember one of the questions and about assets in our community and me seeing vacant land as an asset, right?
Yes.
And that's certainly something that our organization takes into account. We have the Lower East Side Action Plan, which talks about how we can repurpose vacancy to address environmental justice issues. We have all of this vacancy, much more than any other city, which means we could potentially be the greenest city in the United States if we just leveraged it.
Yes.
The other challenge I see is that we are not doing a great job producing a green workforce. I would love to see workforce development say, how are we training people for the future jobs? Every job does not have to be a data center
Yes.
or a battery plant. There are jobs that we can create that will be stewarding our environment.
I was just mentioning this to a friend to say that, we had such momentum, and there's still momentum around a green future and green economy. And I was like, how did we get to a point where it seems like this golden nugget that folks assume is this golden nugget are data centers. Like, the jobs there is you build it, and then there are very few jobs inside there. But if we're talking about a green economy, these are jobs that continuously build upon each other, that are good paying, that are long-term jobs that build skills for folks. And that's the vision that we have to, in our politics, we so often see what's the quickest thing that we can say, oh, I can send out this press release about. And often we see that it may be a detriment to our communities. And we deserve to have public servants that are looking at the long term, addressing these now, and also setting our communities up for a thriving future as well. And I'm excited to be at the table and be in a community with folks that are thought leaders and saying, how do we get this right? And how do we do it right the first time and learn from it and even improve as we go on?
One of the things that our mayor-elect, Mary Sheffield, distinguished herself by is commissioning studies to research some of the problems that we see in our community.
Mm-hmm.
She did that around housing. She did that around poverty and also around things like the entertainment tax and the Downtown Development Authority. I think that's such a critical role for us to look outside of our community and say, what works best?
Yes.
Do you see yourself also, or your triad of leaders also trying to better understand issues so that you can lead in those areas?
Yes, absolutely. Quite often we don't have to recreate the wheel. There are other folks who are dealing with issues that we are dealing with, that have dealt with, that there are also examples that we could look and say, we don't want to go that route because that is something that we see as not the results of it. And we can't be in this bubble or the silo of just, oh, this is what's going on in the city of Detroit. We can look to other places, and I love the example on the entertainment tax because I attended the Citizen Research Council, their presentation on it, and they looked at the other cities. And one thing that I saw was that, they in Chicago, they have a resale tax. And the question in the room came up, well, how do we get to have data transparency from platforms? And I said, okay, well, if a city has a resale tax, then maybe they have already thought about that, and we can look there for data governance and transparency. So it's even those things that answer some of the other questions that we can be prepared for.
Yeah, I mean, and having the Citizens Research Council of Michigan or one of our many universities do some of that benchmarking so that you don't have to is amazing work. I want to talk about your transition.
Yes.
Because between now and January 1st, you've got to do a few things. What do you have to do to prepare to be a city council person?
So we have to build up a team to serve District 7. And that's from a policy team, our community constituent outreach team, our comms, executive team, chief of staff.
What does your budget look like?
I believe this budget is around 1.8 million. I'll have to double check. But
your budget that you control for your office.
It's going to be half going in because I go in at the halfway mark in the year. But I have to double check on the exact numbers. So I'm still waiting on the full budget. But
you got the halfway mark. What do you mean?
So
the calendar year,
the fiscal year,
fiscal year, because it ends September.
Yes. So we go in at the halfway. So they're mandated to keep at least 50% of their budget. The current members.
Wait. No, the city budget starts July 1st.
Yeah, so
and
6
that's
months.
the reason why I see.
Yes.
Okay.
So I'm still waiting on the full budget numbers there. So, but we'll have a full staff of around. We still have to figure it out with the numbers there, but Also, we'll have orientation in December, so I'll get even more information there, and then we'll take office at the beginning of January. What I want to be intentional about is continuing to listen to community. So we're going to be putting together a series of listening sessions, but also just not coming out for folks to listen. I feel strongly about meeting people where they are. So we're going to do telephone town halls as well for folks who are not able or just don't want to get out there to an event in person, but also engaging folks virtually and also doing more door knocking. So that's going to be a large part of our initial coming in to get more information for folks and be present. And we're going to be in the right, as you mentioned with Councilwoman Johnson having the budget workshop, we're going to be right in the middle of budget season.
Yeah.
So really engaging folks on that process as well. I really want to start pushing more, and I know other colleagues, for participatory budgeting as well. I think that is something that really helps bring folks into the fold and also addresses some community desires and needs. And that's a way to really push back on a lot of this apathy that we see, because people are right in the middle of making things work.
You know, you can look at the Detroit budget for a minute and still not understand how things are being spent. Sometimes the categories are so large that they obscure things, and it's really hard to, really drill down and get some information. So one of the things I think would be really helpful is also, even before we get to participatory budgeting, which will require some changes,
Yes.
to have workshop sessions that really just educate people on this is what's in your budget, and pull that information out so that when people are giving their feedback, it's informed feedback
Yes.
and not based on some false assumptions.
Absolutely. In a very digestible way, for sure.
So
Yes.
can you talk about your staffing process? Do you have everybody selected? Is there some place people should send resumes if they think they are well qualified to help lead in your office?
Yes, for sure. We are not fully staffed up yet. So we are looking for policy folks. We are looking for community outreach folks. Also, internal operations or comms as well. And folks can send that if I can just give you right now we don't have a city email address
exactly.
yet.
Just give
But,
your email.
Yep. So if you can still email to Denzel, Denzel, at denzelfordetroit.com. You can email it there, and we'll make sure that we get folks connected there.
All right. So you're going through budgeting. We have an incoming mayor who will be actually developing a budget, and you have priorities. There is a transition process that our mayor-elect is also overseeing. How do you see connecting with our mayor-elect to help bring about the kind of change that the community is looking for?
I think the constant communication and collaboration, and being very clear on where, I know she, Mayor-elect Sheffield, also feels very strongly about housing and has done a lot of work around that. So coming together on those issues to say, one, here's the feedback that we are getting from, and that's why I see my role as well, is that we know that we have the same residents that we're serving, but I just heard this at a community town hall that folks want to have this or want this to move. How can we work together on that? I really believe in that communication and collaboration, and then finding ways to be innovative to say, hey, they're doing this in this other city, right? Can we try this, and can we be thought partners in that? I believe that when this is a common theme, and I hope folks realize that when we are bringing forth those needs in the community and bringing it up, the possibilities are endless, and also that many of these solutions are also in our neighborhoods. As I've been door knocking, folks are saying, why don't we try this? And I'm like, that's a great idea. We should try that. And really more fostering an environment that folks feel that they should be at the center of policymaking as well.
I feel as though a Detroit that's innovative, that encourages participation from so many different places, and that sort of decentralizes some of the power so that people feel empowered inside their communities is an attractive place to be.
Oh, yes.
If you want people to move back to Detroit, give them a sense that this is their Detroit.
Yes.
Because when I was growing up in Detroit, we felt like it was ours. And that sense of this is our city has been lost to some extent. And it feels like the city belongs to somebody else, not quite sure. And even if we like what that somebody else is doing, it doesn't feel like ours.
That's key. And I've seen you see that as you go to folks and they say, well, I'm not going to participate in that. That doesn't help me. And it kind of hurts me when people say that, because every single person in this city should feel that what's going on in their city government is about them and involves them.
And every part of the community, every park in the city is a city park.
Yes.
It's your park.
Yes.
Every place downtown that is public space is your space.
Yes.
The riverfront is your space. And we need to own this city and claim this city so that we don't allow people to box us into this little corner that they've decided is ours. And that's my only concern about the districts, is that somehow I don't want us to believe that we belong to this part of the city. There is one Detroit.
Yes.
And we're stronger together, right?
Yeah, absolutely.
All
and
right.
That's it. And just before we wrap up, just so I don't cross wires, I'm actually going to give a different email address for folks to send a resume. If folks can send their resumes to McCampbel, McCampbell, .D as in dog, A as in apple, @gmail.com. McCampbell.da@gmail.com.
All right. Well, thank you for sharing that information. I'm sure you're going to get a lot of great resumes, and I'm really looking forward to your service.
Thank you.
If you have topics that you want discussed on Authentically Detroit, you can hit us up on our socials at Authentically Detroit on Facebook, Instagram, or Twitter, or you can email us at authenticallydetroit@gmail.com. Okay. It's time for shout-outs. Do you have any shout-outs?
I just want to, I want to shout out to the residents of District 7 for giving me the honor and opportunity to represent you all. I'm very excited about the work that we're going to do together. Shout out to all our staff, our team, our supporters in this race. I wouldn't have been able to do this without you all, so thank you all so much.
All right. And I'm going to shout out our mayor-elect.
Yes.
I am serving on the as co-chair of the Housing Development and Planning Subcommittee committee for the transition team. And I can't tell you how exciting it is to have a mayor who actually wants to hear something I have to say. It's been a minute.
Yes.
Okay.
Yes.
But also there's so many different people and so many voices at the table that are not normally at the table where decisions get made. I always think about that, the song from Hamilton, The Room Where It Happens, and we all want to be in the room where it happens. And so many of us get to be in the room where it happens. And that alone should let you know that this is going to be a different type of leadership in our city. And I say that with caution because it's the mayor of the city, not the mayor of your dreams, not the mayor of your neighborhood. And the city has many competing demands. But we do have a mayor coming in who hears our voices. At least here's my voice. I hope I speak for some people, but here's my voice. Here's the voices of many people. It's a diverse group of people.
Yes.
And when voices are heard, decisions are just always going to be better because you're listening.
Yes. And that's it. And I am super excited.
I've never been more hopeful about Detroit. And normally when I vote for people, I get disappointed. You know, I'm so used to just losing at the polls. So this is an exciting win all around in the city of Detroit. I was really happy on election night.
Yes.
All right. Well, thank you so much for listening. Love on your neighbor. Thanks, Denzel.
All right. Thank you. Take care.